In this video, we're going to be looking at 5 simple steps to understanding frozen shoulder. I will explain what it is, the typical signs and symptoms, and how you differentiate it from other similar problems. Now make sure you stick around to the end of the video, as I'll share with you 3 simple ways to help ease the pain and manage frozen shoulder. Hi and welcome to Envisage Physiotherapy. My name is Matt Hall-Naylor. And my aim for this channel is to empower you to look after your own health. One way of doing that is by giving you the basic tools needed to understand, diagnose and treat typical conditions or problems you would normally seek physio for. Using some very easy and basic methods, you should be able to gain a better understanding as to what frozen shoulder is. More importantly, how best to treat it so you can spend less time worrying and more time getting back to the things you love. Step 1. What is frozen shoulder? Now, frozen shoulder, or adhesive capsulitis as it's sometimes known, is a condition that affects the shoulder. It's usually characterised by pain followed by a restriction in the range of movement within the shoulder itself. In most cases, the symptoms just start out of the blue without any underlying trauma. However, there are occasions whereby the shoulder itself or the corresponding arm may well have been involved in some sort of trauma, and the stiffness is basically as a result of the lack of movement within that joint. Now, the pain usually develops as a low-grade ache, but can progress to a more higher intensity constant ache as time progresses throughout the condition. The stiffening part generally follows the onset of pain and occurs within the capsule surrounding the actual joint, so it's worth bearing in mind that it's not the actual joint itself that's the problem, it's the joint capsule. Now, eventually this will cause a restriction in certain ranges of movement at the shoulder and consequently affects many functional normal uses for the arm. Step 2. The signs and symptoms. There are 2 main symptoms of frozen shoulder. Number 1, an aching pain, usually linear from the shoulder down to the elbow. And it's important again to realise that rarely does that pain ever cross the elbow down into the forearm. If it does, then it's unlikely to be frozen shoulder. And the second part is basically the restriction of the range of movement. Now, this restriction follows a specific term, which is the capsular pattern, as it's known in the clinical world. If you want to know a little bit more about the capsule pattern, please have a look, and there's a link in the video description below. Now, frozen shoulder typically progresses through 4 stages, and whilst the timescale will be different for every person, the period of the initial stage can indicate how long the condition might last. So the shorter the initial phase, the following phases will then be generally shorter, leading to a quicker overall improvement of the condition. However, a longer initial phase can generally then mean subsequent phases can be longer, and therefore a more prolonged period of time to experience the condition. For some, the condition can last for up to 1 to 2 years, so this is why it's really important to get early diagnosis and management. Now we're going to look at the stages. Stage 1, and this is the development of frozen shoulder. And this usually starts with a random onset of intermittent aching pain at rest, leading to a more constant pain. Now, the signs can sometimes be likened to shoulder impingement, but certain characteristics, such as your age, should tell them apart. Stage 2 is the freezing part. Now, pain can start to become worse with movement and generally more intense. Now, you may notice performing some tasks can start to become more painful and difficult to complete. Now we're going to move on to stage 3, the frozen stage. Now, you'll notice a definitive restriction in the absolute range of the shoulder, A high level pain is usually evident when reaching these limitations of movement as well, although heavy repetitive use within these restrictive ranges can also cause a more long-standing aching pain after the activity. Now, the typical functional tasks that become difficult are simple things like washing hair or scratching your back, and above head height movements and putting your hand behind your back. But in essence, the most notable restrictions will be external rotation, out to the side with your arm, internal rotation, and moving your arm out to the front. And at this stage, you may also find yourself waking up a little bit at night, and that's due to you changing position, and it's not normally due to an inflammatory process. And the final stage is the thawing stage. And during this thawing stage, you'll start to feel a lot better, much less pain, and you'll start to experience a gradual improvement in the range of movement, and along with that, your functional movement too. Step 3. Now, there's no single way of defining whether you'll experience a frozen shoulder, but there are some key factors which may increase the likelihood. Those are age. Now, the more commonly affected people tend to be within the age ranges of between 40 to 60 years of age. Females are 4 times more likely to develop frozen shoulder. You find that hormonal factors, so hormonal changes during the menopause, have been suggested as a factor that may well contribute to the development of frozen shoulder. You also find a link between systemic diseases such as diabetes, cardiovascular disease, thyroid disorders, Parkinson's, and cancer have also been linked to an increased risk of developing a frozen shoulder. And finally, as we've previously mentioned, trauma. And this is usually down to prolonged immobility or lack of use following some sort of trauma or an injury to the shoulder or the related arm. And step 4, the treatment. The mainstay of treatment is based around pain relief and maintenance of movement. So we'll talk about pain relief. The controlling of the pain is probably the biggest factor in frozen shoulder in order to be able to sleep, perform your normal function and enable movement of the actual shoulder. But first of all, you need to understand what is truly driving the pain. Now, this comes with understanding both the phase and the behaviour of the symptoms. In the early to mid phase of frozen shoulder, the pain may well be caused by an inflammatory response, which may well be helped by anti-inflammatories or some sort of steroid injection. Usually the pain is more of a constant, irritable at rest pain, i.e. the pain generally occurs when the arm doesn't actually move, it's when it's resting. Or worse, towards the end of the day or evening time. And it may feel a little warm over the shoulder, but it shouldn't be excessively hot, red or swollen. Acupuncture may well be helpful in offering some pain relief as well, especially if there's an inflammatory response causing the symptoms. Alternatively, basic pain relief over-the-counter medication may also be an option. Now, for more information on what inflammatory response is, please see the link in the description. Other treatment modalities, physiotherapy. Now, physio can help with promotion and encouragement of movement in the shoulder. And there's a lot of research that suggests performing stretches in the early stage of frozen shoulder, if it's tolerated, could reduce the longevity of the symptoms and the condition itself. And the final treatment option is surgery. And it's usually used as a very last resort. They will normally perform a joint capsular release. And it's only generally used if the symptoms are significantly severe or they're really hindering your lifestyle, your general functional lifestyle. And it's usually only performed if other alternative treatments have been exhausted. Now, if you require clarity on either the diagnosis or respective stage of the condition, then it's always wise to speak to a suitably qualified healthcare professional. If you would like a consultation with myself, My contact details are in the description below. And step 5, the summary. Frozen shoulder commonly affects those between the ages of 40 and 60. Females tend to be 4 times more likely to suffer from the condition. The symptoms usually come out of the blue with an aching pain and progress to a stiffening of the shoulder movement with a pain towards the end of that range. Pain travels from the shoulder to the elbow. No pins and needles or numbness, burning types of pain, and if that's the case in your symptoms, it's unlikely to be frozen shoulder. Remember, treatment is aimed around the pain relief and movement, and frozen shoulder, albeit painful and frustrating, is not a serious condition, and 99% of the time it leaves no lasting effect once resolved. And finally, as we mentioned before, here are your tips. So tip 1, sleep. Now it might sound simple, and it's really important in life in general, not just with frozen shoulder, and that is trying to go to bed at a reasonable hour, say between 9 and 10 p.m. Now that way, not only does it increase the overall amount of time you spend asleep, which will obviously set you up for a better day ahead, but this extra time will also allow for periods of disturbance that you may experience during the night because of the frozen shoulder. Now if you're finding this difficult, why not try reducing your screen time in the evening, or better still, make your bedroom a no phone zone. Tip 2, and this is movement. Because frozen shoulder progressively limits your overall range of movement, it's really important to maintain as much range as possible as early as you can. Now the shoulder is basically a multi-directional joint, so completing simple pendular exercises performed on a regular basis can not only help with maintenance, but it should also reduce the severity of the loss of range of movement in the mid to latter stages, therefore benefiting your overall function. And tip 3, nighttime position. Now as the condition progresses, it can be normal for those with frozen shoulder to have periods of disturbed sleep. And it usually happens around the mid to latter stages of the condition. Now this usually occurs when you're moving in bed, and it's not because the symptoms are inflammatory. So you see, as we roll over in bed, our arm, or more importantly the shoulder, moves. And because the range of movement will be limited, it then causes more pain when it reaches its end of range. So try this sleeping position. Lay on your opposite shoulder, place a pillow between the arm and your body, and you can also place another pillow behind your back to prevent you from rolling over. I really hope you found this video useful, and if so, please press the like button. If you're new here, don't forget to subscribe to the channel so you can get more informative content to help empower yourself to greater health and well-being. I have some very helpful links to any resources or alternative content I mention in this video, and they can be found in the description below. Now I want to make this channel as interactive as possible, so please leave me a message and let me know how this video was for you. And also, if you've got any burning desires of any other topics that you'd like me to cover on this channel, please leave those in the comments section as well. And remember, you can book an appointment with me for a one-to-one diagnostic consultation. My details are in the description below, or you can download a more in-depth fact sheet on frozen shoulder, again using the link in the description. Thanks very much for watching, and I will see you in the next video.